For reaction to the Health Minister's announcement, I'm joined by Dr. Cedric Sihlangu from the South African Medical Association Trade Union. Dr. Sihlangu, thank you very much for your time here on eNCA. Of course, government has been criticized before for not acting fast enough when it comes to acquiring this vaccine. This has now finally happened. Your initial reaction as an organization to this announcement?
Thank you, Masego, for the opportunity and for the platform. You'd recall about 2 weeks ago, we were in the very same platform appealing to government to expedite this process. I think we are very grateful to government for showing real leadership in ensuring that we prioritize the acquisition and procurement of this vaccine for healthcare workers particularly. So on that front, we really are grateful to the efforts that have been made by government. But critically, obviously, we as healthcare workers ordinarily are advocates of society and our patients. So it doesn't sit well to us knowing that we will be obviously receiving this vaccine, and yet they will be in the initial phases left out. So I think categorically we have to say that whilst we appreciate the efforts of government in ensuring that we receive the vaccine, we want to then move on and say that we're now calling for the national rollout for the entire population, inclusive of those patients who are actually at a higher risk. That's the position that we hold.
Now, Dr. Sihlangu, are we trusting government this time to do right by its citizens? I mean, we know the history that our government has, particularly with distribution of things that healthcare workers need.
Look, very importantly, and I think this came from the executive meeting that I just had not so long ago, the issue of corruption. We've seen this in the PPE procurement processes, but what we're saying is it will really be a sad day in South Africa if you find that you've got about 1 million doses of the vaccine that have been procured or acquired, and only for there to be shortcuts that are given, that of the vaccine given to politicians and those who are proximal to power. And that would be a really sad day, and we call upon all systems in government to ensure that that does not happen. We want this 1 million doses to go to those that it is intended for, and those are the healthcare practitioners in the front line.
Now, are you privy, Doc, to any information about when exactly this vaccine will arrive on our shores?
Well, as you know, from the announcement from the ministry and the engagement in Parliament today, we only have the outline that we've been able to acquire the virus. We still expect SAHPRA to do its due diligence to ensure that the virus, number one, is safe, and it's safe for South Africans, and it's safe for us to begin using it in the country. We don't think it's wise for us to simply accept that other regulatory bodies in other jurisdictions have approved the virus for use in their countries. We are saying we want a surety from SAHPRA to ensure that this virus is safe for use in South Africa before we begin distributing it and rolling it out. So we want SAHPRA to give citizens that assurity. And so far as when the specific dates are going to be that we're going to begin rolling it out, we still await the intricacies and the technical analysis of how the rollout is going to happen, but we haven't received that detail as yet from the ministry.
What's the overall consensus of your members? Are they relieved with this announcement by the minister today?
I'll tell you what, again, stemming from our engagement with the leadership today, what is clear is that one knows that every seasoned commander or general in an army would want to ensure that when in combat or at war in battle, your soldiers are equipped with, number one, necessary ammunition and the armor. And we feel that this is a right step in the right direction from government, and we are applauding that. We're happy about that. But we're saying, let's step it up a notch. Let's now begin a full rollout for all our citizens, because we will get depressed if we as health professionals are immunized and we've got the protection, but every day, every patient in front of us does not have that ammunition as we do, and watch them die. So that's going to really cause a lot of problems. So we're now pushing aggressively to say, well, fair enough, we are going to prioritize, but let's begin the national rollout. And that's our position, really.
Talking about stepping up, it's not only the vaccine that's been a problem and that government has been criticized about, it's also the healthcare system in our country. COVID-19 has actually shown some of the cracks in the South African healthcare system. For instance, Doc, things such as good infrastructure and equipment that is needed, and the adequate employment of more staff at hospitals.
Certainly, I think in many levels, this not only in South Africa though. I mean, it's across the the world where many countries have begun to see, the big cracks in their systems, and certainly we've seen that in South Africa. But what pleases us as a union is that the current procurement method of the single buyer, I think it goes in line with, the envisaged NHI that's going to be coming. Because could you imagine a situation if this vaccine was allowed to be procured or obtained by any other person other than state? We'd begin to see the inequalities in the country, and we begin to see that the haves and the have-nots, and those who probably already have been vaccinated. So we're quite happy with the position that government has taken in ensuring that the vaccine is procured in the particular fashion that they're doing now.
Well, thank you very much for your time this evening. That is Dr. Cedric Sihlangu of the South African Medical Association Trade Union.